us, Kurena. Yusuf, let me turn to you now. Can you tell our listeners what is the disease all about, and what are the signs and symptoms that one can be able to say, yeah, if I have this, I experience this, it means it's a sign that I have contracted the disease.
Okay, first of all, I would like to start by making a particular explanation regarding the condition of the hepatitis.
Yeah.
There is quite some misconception when it comes to translating it to Hausa.
Okay.
Because in Hausa, we normally just call it Chiwon Hanta.
Okay.
But the English terminology hepatitis is actually much beyond the Chiwon Hanta we call it in Hausa. Because it's a broader word. And by definition, hepatitis is simply inflammation of the liver, which can be caused by several factors, which includes alcohol consumption and viral condition. So the viral is the one we are talking about today. That is caused by virus. That is when we're talking about hepatitis A, hepatitis B, hepatitis C, and the rest. So when it comes to these various types, the one we are particularly concerned about is also hepatitis B and hepatitis C, because these are the dangerous ones that can eventually become chronic. This virus affects the body of an individual. They can get into various sources. It could be through maybe unprotected sex. It could be through mother transferring it to her child, to her son or daughter during childbirth.
Okay, but not hereditary.
It is not hereditary.
Okay,
or the mother can transfer.
as a result of poor management, and then
not poor management during childbirth.
okay.
Normally, when the child is inside the womb of his mother,
Yeah.
she cannot transfer that virus to the child.
Okay.
Because there's a barrier.
It's not
there's a protection.
genes related.
It's not genes related.
Okay.
But if she has it at the cost of giving birth,
Yeah.
there is splitting of blood and whatsoever.
Yeah,
At
yeah.
that point, there is
That's
a
what I mean by
communication.
poor management.
Yeah,
Yes.
basically,
Don't
it's
mind my
inevitable.
layman
It's
English.
inevitable. The communication between the mother's blood and this child's blood during childbirth is inevitable. You
Yeah.
cannot prevent that.
Yes.
The only prevention for that is after delivery, we can vaccinate the child to prevent
Okay.
it from developing in the body of the
Okay.
child. So it could be majorly through these three sources.
Okay.
First, okay, I didn't mention the third one. First, it could be through unprotected sex. Second, it could be from a mother to a child. And the third, it could be utilizing any material that an infected person has used. It could be a needle, it could be a razor, it could be a syringe. That the blood of an infected person has touched that particular material.
Yeah.
If you use it and it touches your blood, it might be minute. It can go into your blood and cause hepatitis B or C. And one thing about this virus is that it can stay viable outside the body at the room temperature. If I have hepatitis and I bring my body, the blood is here for about 7 days, at least 7 days, it can still be viable.
Active.
And the moment you inject it into your body, it will still go around and cause hepatitis in the body.
Okay.
So these are basically the three major causes of hepatitis.
Okay.
And talking about the symptoms of hepatitis.
Yeah, sorry, before you go to the symptoms, can you educate me and then the listeners? The mode of transmission you mentioned are almost three now.
Majorly.
And majorly three and similar to the one for HIV. That's through blood injection, through unprotected sex, and so on and so forth. Is there what difference does it exist between the mode of transmission of HIV and then this disease?
There is no actual difference. It's just the virus that matters.
Okay.
An HIV patient, and a patient who has HIV and hepatitis and has an unprotected sex can transfer both to the partner.
Okay.
So the mode of transmission is the same.
Okay.
Just that the virus differs. The symptoms that would be seen in each for hepatitis is different from HIV.
Okay.
But the symptoms is
Thank
actually
you.
the same.
Then the sign and symptoms.
Okay, when it comes to the symptoms, there is no apparent symptom that would be dedicated to hepatitis. That you see this and say this individual has hepatitis. And that is one of the detrimental thing about it. It is hidden. But there are a few things that we can see that will give us an idea that maybe this individual has hepatitis. But they are not subjected to only the hepatitis.
Okay.
Other things can also cause those symptoms, which include first, as you mentioned, fatigue. With feeling tired all the time. You have not done anything, work out feeling tired. Other things might cause that, but then hepatitis might also bring about this symptom.
Yeah.
Second is jaundice, yellowishness of the eyes, of the skin. And then third could be swelling of the abdomen. Let me use layman language. Swelling of the stomach. The lower trunk would swell. So these are symptoms that might appear in few people that have hepatitis, but in most cases, they do not see any symptom.
Okay.
So that's basically about this.
Okay. So I think Listening to The Advocate. The Advocate is a production of Peace Ambassador Center for Humanitarian Aid and Empowerment in partnership with Ministry of Information and hosted here in the Station of Peace, that is under Kura Radio International. This week we are discussing about tomorrow is going to be World Hepatitis Day, and then here with me in the studio three young, vibrant medical students who have taken into themselves to sensitize the community on how to be aware of this day. We have Ali Bukar Kolomi, a 200 level student and youth advocate and a part of this family. We also have Yusuf Zango, a 300 level student, and also Abdel Samad Yahaya, of also 200 level student. We're having an in-depth discussion on the disease, on how one can prevent it. Kolomi just spoke to us on Kanuri on how young people can be able to protect themselves from coming across this disease. So in English, can you tell us how the young people can ensure that they do not get infected with this disease?
Okay, I would like to start by talking about the prevention for a child. Okay. Since we mentioned from the very beginning, a mother can transfer it to daughter or son. So the first thing after giving birth, having known that a mother has hepatitis, or even if she does not have, it is very important to vaccinate the child against hepatitis. And there is actually a vaccination against hepatitis type A, type B, type C. Even though they are different. For the hepatitis type A, as I mentioned earlier, is not that it does not become chronic. Normally, our body can even fight it by itself. But for the B and C are the ones that can become chronic eventually.
Okay.
So the prevention for hepatitis type B, the only way we can prevent it is by vaccination. And if it is detected before it becomes chronic, we can still vaccinate an individual even if he has become an adult. So for the type C, you can also vaccinate an individual against hepatitis type C. And for that one, we can even cure it. That's the difference between B and C, even though both can become chronic. But fortunately for the C, we can cure it by using antiviral drugs. But for the B, we cannot cure hepatitis type B. We can only manage it. And that is why we don't even want it to reach that stage that we will start managing it, because it costs a lot. The Hausa people used to say, "Same could easy kula chiwon hanta," because it's very costly. You would keep spending money trying to prevent its metastasis that is spreading to other part of the body. So the only thing we can do is to prevent that. So the best way to prevent it is from the beginning, vaccination. Secondly, when you have an idea from the symptoms, though they are not always there, that we mentioned at the first beginning of this program, you can go to the hospital. They can take your blood and find out whether the condition is hepatitis or not. As I said, the symptoms are not restricted to only hepatitis. So these are the best way to prevent the disease of hepatitis.
Okay, but going back to my question now, this program is for young people. A young guy now that is not infected, what measures can he take so that he do not contact this disease?
Okay, first of all, he needs to restrict himself from having an unprotected sex.
Okay.
Ideally, if we are talking about religiously, I can say he should not even get into that except with your partner, be your wife. It should be your wife. So, but that is the first thing to take note of, and that is why it's very crucial. If you have hepatitis, you need to know. You need to let know by your partners.
Okay.
Your wives. If you are a female, your husband needs to know you have hepatitis to prevent him from contacting that particular disease. And second, you need to...
Sorry, before I skip that, for instance, a lady that is having the disease, she refuses to tell her suitor and they got married. So
then he's bound to getting that hepatitis.
What is the chances?
Unless maybe he was already vaccinated against that disease.
But if he's vaccinated, it means he's now...
He already has a protection against that.
And it's guaranteed.
His body has already developed the protection that if the virus gets in, there's a very less likeliness of him getting contact.
But what is the advice for you? Have a sister and she has a boyfriend that want to get married to, and he has that disease. As a medical doctor, what's the advice?
And he has that disease that they should take. He has that disease.
Is it not so the first manage or they should just manage?
First of all, I would say, was the wife vaccinated? That's the first thing you need to look at.
Okay.
If she vaccinated, she has a protection against that.
It means it's sure that there is no problem.
I cannot give you 100% assurance.
Okay.
Other than that, maybe they should consult a medical personnel.
You are a medical personnel. That's what
when I'm still on the jury.
Thank you for being honest with me. Yeah. Let's go ahead.
Okay.
What are the other measures?
The prevention. Yes. Avoid using materials or utilities that an infected person has utilized.
Okay.
Maybe in the process of getting a tattoo.
Yeah.
Even in the process of getting tattoo, your blood, hepatitis individual blood can split on that metal that you used to make the tattoo. And as I mentioned earlier, this virus of hepatitis can stay viable for about 7 days under room temperature. So if you have been tattooed and you have hepatitis today, 3 days after another individual got hepatitis come for a tattoo and it mixes with his blood, he can easily get infected by that. It could be from utilization of razor blades. A friend who has hepatitis use a razor blade, he cut himself and then use it as well. You cut yourself, you would end up having hepatitis B. Yeah. And what other way? You should just anything that would bring about coming together of your blood and an individual who has that hepatitis, you should avoid it. Exactly. Thank you very much. This is an interactive program. Masu sauraron mu wannan dama program ne da za mu ba masu sauraron mu dama su ma su dinga tambayan masana. Zan ce ɗalibai ne kuma masana ne.